Good afternoon. I am Dr. Patrice Harris. I'm the Chief Health and Medical Editor here at Everyday Health, and it is an honor and a pleasure for me to interview Dr. Leroy Sims as part of our Black Health Facts Changemaker series. Dr. Sims is an emergency medicine and sports medicine physician at Mills Peninsula Medical Center in Burlingame, California, and Senior VP of Medical Affairs for the NBA. And Dr. Sims was instrumental in organizing the bubble. I know he had a team, but certainly I'm sure it was due to his leadership that allowed the NBA 2019-2020 season to continue more than 4 months after it had come to a halt because of COVID-19. So let's go back to January and February of 2020. You were in Paris with the NBA, and of course, we were all beginning to hear about the pandemic. We know now, but we didn't at the time. So based on what you were seeing and hearing at the time, what were some of your earlier thoughts? And of course, as related to how this might impact the NBA?
The NBA is a global organization. We're a sports institution, but also entertainment and media as well. And we have offices around the globe, including in China. So early on, we were getting information about what was happening in Wuhan and looking to see what was happening. None of us knew then that this pandemic was going to happen. We knew there was an outbreak and wanted to know more information. We sent our first memo to teams and staff on January 31st. And at that time, alerted them about the situation, what we knew about the virus transmission. We highlighted public health prevention measures, hand washing, symptom checking, distancing. And that was the beginning of it. So the earliest thoughts I have from Paris was preparing those memos and talking points, reviewing what was being said by WHO, CDC, talking to our counterparts at the US Embassy and consulates in China to get as much information as we can to alert our staff about the situation. Again, not really knowing where this was going.
And then Dr. Sims, just a couple of months later, on March 11th, the 2019-2020 NBA season was suspended. And I remember thinking, certainly as a physician, and I was president of the American Medical Association at the time, clearly what we were hearing had my attention. But I've said this before to you that when the NBA suspended their sentence, I think it made us all stand up and take notice. And so you suspended the season March 11th, the NBA did. How soon did you start thinking about next steps and when and how the season could resume?
Recall, Dr. Harris, that when we did suspend the season on March 11th, that suspension was meant to be for 30 days. So we wanted to see how the situation played out, what was happening in terms of transmission and cases, and what we could do in terms of resuming our season. But as you know, the pandemic really started to unfold, cases started to increase, and that 30-day period was upon us, and it was clear that we wouldn't be able to start right then and there. But a lot of collaborative efforts started to go into place. We were talking to other organizations, asking questions, gathering information. We started to seek out experts in epidemiology, infectious diseases, certified industrial hygienists, statisticians, to see what was coming and if we were going to start to plan to resume, how we could do it, where we could do it, and in what manner we could do it the safest. So after we got to that 30-day period and we knew this virus was continuing to emerge and new information was coming out about asymptomatic transmission, the utility of masks, the presence or lack thereof of PPE for healthcare providers, lack of ventilators, all of that we were absorbing and trying to see, does it make sense and for us to resume? And if we are going to resume, what's the best way we can do it? And so we searched far and wide and engaged the best and the brightest to help us come up with ideas and a plan.
And I also want to give another shout out to you and the NBA, because I think the restarting the season was important to us as a society. Everything, of course, as you well know, and our listeners know, was shut down, and we did not have the usual distractions, and people were worried. And so I have to tell you that I always say, and I've said this to you personally, that the NBA really, I think, helped our country get through at least that early phase of the pandemic. So just let me thank you on behalf of a whole lot of people. So talk a little bit about the bubble. Because a lot of sacrifices were made by the players, staff, coaches, everyone. So how many people were in the bubble? And tell us a little bit more. I think we saw it from the outside. We know you were at Disney, and a lot of people think, well, being at Disney isn't all bad, but tell us a little bit more about the actual bubble.
We started with a very short runway from the time we suspended our season March 11 to the time we agreed with the National Basketball Players Association to move forward with resuming our season. And we had to consider all aspects of the bubble. First and foremost was going to be the physical and mental health of anyone who would be there, and the way to operationalize a bubble and make it livable. If we were going to be there for a few months, it not only had to have the essentials in terms of testing and masks, PPE, and all of the things that we needed to help make people safe. But if we were going to do a closed campus, we needed to consider the fact that we couldn't send people out. So we needed to have as much as we could in. And that included having an on-site medical clinic, imaging resources. We had to make sure that it was livable so that people had opportunities to exercise, to take walks, and to have fun. We were going to be there for months on end, and it couldn't be all work. To do that, we had to think about not only the medical, but the social, the emotional. And we had lots of stakeholders who were there. Of course, we had 22 teams and their coaching staff and team staff. We had NBA staff. We had media, we had broadcasters, and all the people who were there to help us operationalize the plan, from transportation to food and beverage to activities and on-campus excursions. So it was a lot of collaborative effort. It was not just medical by any means, but medical was intertwined in all of it. If we were transporting people from the hotels to the arenas, we had to think about spacing and ventilation. If people were going to eat, we needed to make sure that there was physical distancing, and that we could do things in a very responsible manner. Even when we got there, we had people quarantine for a short period of time. And how could we make the quarantine not too onerous on people? And after that, testing every day, getting people to be compliant with the protocols. We had to think about how could we harness technology to be able to remain compliant, make sure that people were testing and we weren't missing anyone. If someone did test positive, that we were able to follow up with them quickly to abate any transmission. So it was a massive, massive lift, lots of collaboration and lots of meetings to make sure we stayed on top of everything. So the events group met, the medical physicians we met with the athletic trainers every day. We had a testing meeting twice a day to go over the results. We met constantly to make sure that we didn't drop the bubble. And from time to time, we would bring everyone together virtually to provide updates. This is what we're seeing, this is where we are, and this is the next step. To the best of our abilities, we made sure that we kept things safe with an eye on the future, so that if we were going to have this livable, workable situation, what would it look like if we were to allow players to bring their families down? And could it not just be for the people there working, doing business, but for kids? So the bubble was its own unique period in time, its own experiment, its own experience, and a lot went into it to make sure that we did it the right way, to really make sure people were healthy, were safe, but to trickle in some enjoyment in the experience as well.
Dr. Sims, you mentioned mental health, and as you know, I am a psychiatrist, and by the way, the NBA has led on this conversation. The NBA has had relationships with psychiatrists and other mental health professionals, and made sure that your players had access to any mental health services that they needed for a long time. Can you just double click quickly on mental health, and you can either talk about it more broadly or talk about what activities or how you thought about mental health during the bubble and the quarantine?
We thought about this through and through. When I'm a part of the planning for an event or experience with the NBA, one of the things that I always help to put together is an emergency action plan. What do we do in worst case scenario? What are the resources? We also had a mental health emergency action plan. Not only did we bring physicians to the bubble to help us take care of the people who were there, we had a clinical and sports psychologist with us in the bubble, with office hours, on-call hours, and we partnered with local psychiatry and psychology professionals to be on call. Knowing that we had a large number of people there, we didn't want anyone to have to wait for services. So we had telehealth options that were available. We had in-person options that were available in the bubble. So that was the extent that we went to make sure we could take care of people. Now, keep in mind that our teams also, all 30 of our teams, they have mental health providers that are associated. So we made sure that they were ready and on standby for anything because they have the relationships with the players and the team staff. But for those who didn't have that provider or that access, we made sure we were covered so that anything that came up, whether it was people having difficulties with the quarantine, people struggling being away from family for extended periods of time, anything you can think of, we made sure that we were ready. And if we got to that point of an emergency, and we know that sometimes those happen, that we were prepared with an action plan, that we didn't just have a knee-jerk reaction, we were planned and ready if the worst case scenario did happen. We had lots of activities in the bubble that we thought about to take the everyday stress out of being there, whether it was people being able to have bicycles available to ride around the campus, fishing. We had lots of people participating in pickleball. That was one. Slam ball was another. Cornhole. Whatever we could do to take people's minds off of just the everyday work and to do something fun. Again, I mentioned that we made sure to be attentive to people's ability to exercise and get some physical activity in. So, you know, there was about a 2-mile loop around the campus where we were. People were out running and walking and hiking. So they had that opportunity. We did have the gyms open for people to get some exercise in, and then the swimming pools were open as well. We sometimes have to limit the numbers, but we always thought through how we can help people get some fun activity, physical activity in there. So there was a lot. We did movie nights with a television or a projector and a screen out on a lawn, physically distanced, better ventilation. So we did as best we could with the tools we had to make sure it was an enjoyable experience.
So let's talk about you for a moment, especially now as you look back on it, and perhaps during those early months, you were just nose to the grindstone, getting things done. But tell us a little bit about what your life was like during, March and those early months. And then when you had the opportunity perhaps to take a deep breath, or maybe you didn't, when the Lakers hoisted that trophy and, that was the end of the bubble. How did that feel?
It felt so great to get to that point because it took so much time and effort and commitment. And I can't tell you the massive exhale of exhilaration of we did it. It felt like a dream. I remember the night that it came to an end, and just being there, just shaking my head, saying I couldn't believe that we had done that. And I mean, I was tearful. I felt so responsible for so many lives. All of these people are my colleagues. but at some point you make the transition from colleague to patient. And so I really honor my Hippocratic oath, and I value the doctor patient relationship and building that trust. And so that was great to get to the end. But in those days, those early days of March, leading up to the bubble, I was still practicing in the emergency room. I was still working with the NBA, thinking through solutions of how we could resume, gathering information, tracking what was happening with the pandemic. And it was exhausting. It was a very challenging time. My hours were very long, very early, very late, and my sleep did take a hit. However, I leaned on the things that are most important for keeping me grounded, exercise being number one. I made sure that I found that time, whether it was going for a run, going for a walk, just getting out. I needed that downtime. Dr. Harris, I'll tell you, I tell people who know me, if you want to get a sense of how I'm doing, rather than saying, Leroy, how are you doing? Ask me, have you worked out today? Or do you have a plan to? If I can work out, that means I found the time, I made the time, that's a good day. You can ask me, how much caffeine have you consumed? Generally, a cup of coffee in the morning, I'm good. If I have to supplement that with an espresso or two, that means that I haven't been sleeping much and I'm going. Number two was my family. I made sure that we had time for each other, and we started to institute things to make sure we had touch points, whether it was family movie night on Fridays or getting on our bikes and going for a ride. We made sure that we had time together because the work could be consuming. We made the pivot, remember, to schools going remote. So all of a sudden we were all here and we had to figure out how to live in this space. But also I relied on my faith, which makes a big difference for me and my community, making sure that I kept in touch with my family, my grandma, mom, dad, brothers and sisters, my best friend, and that we didn't drift apart. And so having those breaks, those opportunities were really important. One of the things that our hospital did was they provided free mental health specialists for frontline workers. And I made sure to pair with a therapist. And we had an appointment every Tuesday it was 4 p.m. Pacific time. And I kept that appointment through the bubble all the way through December. So I started with her in April or May, and we met weekly. And that was a time for me to address anything that may have been in my blind spot. I don't pretend that I am a plumber or that I am a mechanic. When things in my house or my car need attention, I go to a specialist. When I'm dealing with a pandemic and stress, I go to a specialist. And I made sure to let people know, because I know there's that stigma of mental health and having a provider. And I let people know, sorry, I can't do that, or I can't cover that game. I have an appointment with my therapist for this hour. And try to normalize it, take away some of the stigma. And that helped as well. So I made sure to pay attention to exercise, made sure to eat well, to build upon those relationships that had sustained me, my faith. And then I had a therapist who helped me as well.
You mentioned that the NBA didn't have a playbook. That is correct, but you essentially wrote the playbook with your learnings. Your efforts resulted in a 113-page health and safety manual that, again, is essentially a playbook for other large gatherings, your Broadway concerts, other sports gatherings. Of course, we know that there was a time when we certainly had to close some of these large gatherings down. But because you all sort of were the test case, if you will, how do other sports teams or others who are thinking about large events, do they come and ask the NBA for guidance and advice?
It's a two-way street, because the different sports have different things they have to take into consideration. But indeed, we talk to soccer leagues. They're an outdoor sport, which is different from us. We're an indoor sport. So we definitely touch base with them. Even though the NFL was out of season, they called us. We talk to them. We share strategies. What are you thinking about? Who are you talking to? So whether it was US football or global football, we had conversations. We talked with the Tennis Association. We talked with Australian rules football, rugby. So it's such a collaborative effort because no one institution has the playbook that everyone can rely on. And all of us have to make adjustments based on our personnel, what the game looks like. Again, playing an outdoor sport versus an indoor sport is just markedly different, no matter how you slice it up. Our players are playing an indoor sport in close proximity, unmasked. And when you think about what's the definition of contact tracing and a close contact, have you been within 6 feet of someone for up to 15 minutes? It's like, that's everyone in the contact tracing process. So we have to think through those. And we did collaborate with other venues, other institutions, other sports. And likewise, they reached out to us. And it's been a very much open exchange going back to March 2020, all the way up to today.
Well, Dr. Sims, we all know that representation matters. And quite frankly, we need more people who look like you and I in healthcare. So what do you think young folks who see people like you and I in our respective roles think about pursuing a career in medicine or in healthcare or in sciences or any of the so-called STEAM career paths?
I think it is vitally important that people see others who look like them, that we share our stories, that we celebrate the diversity that is within even our own community. And I spoke earlier about the inspiration that I had from seeing Dr. Ben Carson in 1987 and 1988. Just seeing someone who looked like me gave me that thought of, maybe I can do that. And I hope that people see me and get that sense of inspiration, but also communicating about the importance of the diversity, communicating about my history, letting people know that I come from the west side of Chicago, And I didn't grow up on third base. I had to grind it out. I had to work hard. I was surrounded by poverty, drugs, and gangs, but I kept my vision straight and I relied on my community. And so letting people know that we're not that different. But not everyone shares that story of coming from inner city and whatnot. And so then it comes to, well, what did you do to be successful in sharing that playbook? I sought mentors. I asked for help. I sought scholarship and I pursued excellence vigorously to make sure that I made it. I didn't make excuses. And all of those people who allowed me to put my hand in theirs and they pulled me forward, they opened the door for me. It's now incumbent upon me to do the same. And I have to not only feed into the pipeline, but to be accessible, to be tangible. And so, one, we have to highlight the fact that, yes, we do need more providers. When we have opportunities to mentor, that we're there for those providers. But even if it's not just medicine, I make sure to talk about the science, as you say, science, technology, and engineering, mathematics. If someone doesn't want to be a doctor, you can be a nurse or a physician's assistant or a dentist or a technician. There's so many different avenues for people to pursue. It doesn't just have to end with MD. It can end with PhD or a master's degree or a bachelor's. So many opportunities. So I want to make sure people understand that it's not a one path fits all. You don't have to go to medical school. And if you don't want to, there are other things that you can do to enter medicine. No matter what you do, number one, feel free to change your mind. I told you I thought about being a neurosurgeon, and I carried a burden because I told everyone once upon a time I was going to be a neurosurgeon like Dr. Ben Carson. And when I was deciding to go in a different direction, I knew people would say, hey, what happened? And it's okay. Own your narrative and your story and say, I have a different interest. There are other things that I want to pursue, and this is a better fit. So changing your mind is okay. But also letting people know to be curious. Don't lock yourself in. Be open to different pathways. Maybe it's science, maybe it's tech, maybe it's financial technology. There's so many things that you can do. But whatever you do, pursue excellence, find mentors, people who look like you, ask questions, ask for help. And in doing that, I think we can really rise the number of people who are in our professions and who are giving back. I make sure everyone knows, no matter what you're doing, you can't just look for it. You have to look and reach back to give people opportunities, because someone gave me an opportunity. How different would my life have been if the chair of orthopedic surgery at Stanford didn't come to me and say, hey, would you like to be the team doctor and medical director for the Golden State Warriors? We had a lot of people in the department. He gave me an opportunity. And so we have to look for opportunities, advocate for ourselves, advocate for others, and pursue it when we get it to the best of our abilities. And so that's what I hope that I can use this for. And I try to share messages like that in interviews like this or in community meetings. And I make sure that I'm accessible to our community, whether it's through churches or community health organizations, or through schools, Boys and Girls Club, you name it. I try to be actively engaged and involved to make sure that I'm feeding into the visibility, but also the growth of people like us in these professions.
What are your hopes for change in the future?
That's a big question, and one that I need to pause and reflect on. There's a lot. I can take this from a lot of different angles, whether it is what I hope for medicine, what I hope for society. First and foremost, I would say my hope is that people are open to the diversity that is the human race. We all have a different story to tell. We all have our own lives to live. And for people to be open to our differences, to appreciate them, and to not put boxes around people based on their beliefs, their ideas, their pursuits, to really understand each other and to celebrate each other. That's one of tolerance. Another thing that I hope is that we share in the opportunity, that we provide opportunities for those who are less fortunate, that we commit when we do have to the uplifting of others. As scripture says, to whom much is given, much is expected. And so that is another one that, we don't just build wealth, that we share it. I can think about vaccines, that we don't stockpile, that we share and make sure that we roll these out so to people and places where it may not be necessarily available. The other thing that I hope ultimately is that I can be in a position of leaving this world as a better place for my kids, for the next generations, and that I can do things that would make my late grandmother proud. The things that were instilled in me, those seeds that were planted, that it germinates in such a way that I have a significant impact on my family, my community, medicine, and sports. This is the world that I live in as an emergency physician in sports, and it's a full circle. And in some instances, my work is treating people acutely at the point of an illness or an injury. But on the other end of the spectrum, the work that I do is trying to maximize someone's physical and mental capabilities, whether it's at a high school level, amateur level, or professional sports level, or getting someone back after an injury, rehabilitation, so that they can do the things that they love. So, I want to take care of people holistically. I want to use the microphone that I have, the camera in front of me, to vocalize the importance of really making sure we pour into people. Again, this pandemic, it's highlighted, if not exacerbated, the inequities that exist among us and between us, and thinking about how can we change that narrative? How can we close the gap and really provide for people, and meet them where they are, asking questions of ourselves and them, listening and developing a plan that is tailored towards individuals and communities. So that's my pie in the sky of of what I'd like to see. I mean, it's tough. It's tough knowing that sometimes people treat you a certain way before you ever open your mouth, just based on the color of your skin or their perception of who they think you are. And so I say, you know, let's be tolerant. Let's give each other a fair chance. Let's open up our minds to new cultures, new ideas, new identities, and ultimately grow a world where all of us can flourish in whatever it is that we do individually, professionally or personally.